Good evening, I'm Shannon Horry.
And I'm Antonio Morrow. We begin tonight with a massive plan to vaccinate every public school child in Broward County against the H1N1 virus.
The first batches of the new vaccine are being distributed this week. South Florida is expecting its delivery next week sometime.
There are two types of vaccine, a shot and a nasal spray. It is the spray that is expected to arrive here first.
The Centers for Disease Control recommends the H1N1 vaccine for pregnant women, people with weak immune systems, and all children starting at age 6 months to 24 years old. And it's that last recommendation that has Broward County making plans to give all school kids a vaccine for free. CBS 4's Joan Murray is live in our Broward County newsroom with specific information that every parent needs to know about.
We had the flu last year and it was horrible.
So Liz Farringer isn't thinking twice about letting her kids get the swine flu vaccine.
It sounds like a no-brainer.
With Broward Superintendent's blessing, all school children, elementary, middle, and high school, will be able to get the swine flu vaccine free of charge during the school day. That's over 250,000 doses available.
The disease has been widespread, but has up to this point been relatively mild. We have been fortunate, but we still need to make sure that we are protecting our children who, as you know, are in the high priority group for vaccination.
Broward Public School parents will have to sign a consent form. The vaccine is being offered in nasal and needle form. Broward Health Department workers will supervise the vaccinations.
We will be sending information out to all 250,000 children, their families, in 4 different languages, which is something certainly even Washington wouldn't necessarily think about.
Kai Stokes' mother is saying yes for one big reason.
Because I don't get sick.
But other parents, more than a few, said the swine flu vaccine is untested and they fear the risk. Here's what we heard.
I think too many things have gone wrong. There's too many risks. They've rushed this understandably. There's a concern, but I also have a concern for the future health of my children.
There's so many vaccinations here in this country that it's just beyond. And I feel that without the shot, we can still survive.
I just think that people die from diarrhea all the time and people die from the flu, but just because this one's being touted as worse than others doesn't necessarily mean it is.
I'm going to ask my pediatrician for his opinion and go by what he recommends.
And that is exactly what the school district is recommended, that you check with your family doctor to see what he recommends for your children. It all gets going about 2 weeks, October 19th, and will take about a month to administer. Reporting in the Broward newsroom, Joan Murray, CBS 4 News.
So much to consider, Joan. Thanks. So what about parents? Should you get the vaccine too, even if you don't fall under the high-risk groups? Doctors say if there is enough vaccine available, you can get one if you'd like. Experts say it won't hurt you, and of course it will protect you and your child from the H1N1 flu because you won't be bringing home the virus. For more information on the vaccine, including a fact sheet on the H1N1 flu and links to the health department websites, we have made it very easy for you. Go to cbs4.com/health.